Hello everyone, myself Dr. Swapnil Pattanshetti, Consultant Pediatric and Neonatal Surgeon, KLS Prabhakar Kore Hospital, Belgavi. As a part of Pediatric Surgery Awareness Week, theme for this year is Protect the Unborn Child. How can you do that? If you are planning a baby, it's always better that both the parents should have a good nutrition. They should be emotionally and physically healthy. Once you have decided to plan a baby, it's always better to start with the folic acid 3 months in advance. The mother should take tablets like iron, vitamins or calcium as prescribed by the obstetrician. The mother should ensure that they take a healthy nutritious diet throughout the pregnancy. They should also follow exercise, meditation, walking throughout the pregnancy. And the most important in the Indian scenario is to have a medical insurance which preferably even covers the newborn baby. During the anomaly scan, which is usually done in a second trimester, if your baby is diagnosed with any congenital anomalies, it's always better to take opinion of a pediatric surgeon, especially where the baby might require a neonatal surgery in future. And to plan a delivery in a center where there is a good neonatology team, availability of the NICU ICU as well as the neonatal surgical expertise. Few conditions in pediatric surgery which may require the antenatal counseling and postnatal management are like suspected esophageal atresia, where the baby's food pipe is not well formed and it may be even connected to the trachea, a windpipe, due to which the baby may not swallow food or milk. Hence, these babies are required surgery during the neonatal time, that is newborn period. Few other conditions like intestinal atresias or duodenal atresia, where the intestines, a small bowel, is not well formed, due to which the baby may have a abdominal distension, will require surgery in the neonatal period. Other conditions of kidneys like fetal hydronephrosis, when diagnosed during antenatally, needs follow-up during postnatally. 80 to 90% of these patients may not require any surgery, but 10 to 15% of these babies will require surgery for the conditions like pelvic-ureteric junction obstruction, vesico-ureteral reflux, or posterior urethral wall management. The conditions of the spine like spina bifida, like meningomyelocele or meningocele, where the spinal nerves or the spinal cord may herniate outside, which requires surgery during the newborn period for a better outcome in future. Condition like hydrocephalus, where there is an increase of CSF in the brain, due to which the pressure increases and delays the brain development, which requires ventriculoperitoneal shunting for the better development of the brain. Conditions like abdomen wall defects, that is gastroschisis or omphalocele minor, omphalocele major. However, these conditions have a higher morbidity but still can be managed well at a better center. There are few tumors which can be diagnosed even antenatally, like sacrococcygeal teratoma, renal tumor like mesoblastic nephroma, or even adrenal mass like neuroblastoma. These all can be followed postnatally and managed well for a good outcome. The condition like congenital diaphragmatic hernia, where there is a defect in the diaphragm, that is the muscle which separates the abdomen and the thorax. Due to this defect, the bowel and the organs like spleen and kidney may move into the thorax, and due to which the lung is not well formed. The outcomes in all these conditions are known to be better when managed at the centers with the availability of the well NICU team as well as the neonatal surgical expertise. The best thing to protect the unborn child is to prevention, that is to have a healthy nutrition, follow the advice from your obstetrician, take the drugs as planned, and in case if anomaly is developed, to plan it in a way that it is delivered and managed at the better centers which are known to have a better outcome. Once the anomaly is done, our job is to reassure the parents. Let's not lose our hope and faith in the management of the congenital anomalies. Thank you, one and all.